Okay, y'all. So we are being dismissed from the hospital following his first deep brain stimulator surgery, following the Widowmaker heart attack, following that surgery. This is 2 weeks from the day of his brain surgery on a Friday that we are being dismissed. In the morning, a Zoll representative comes into the room with a big box and starts training us on a external defibrillator vest, which my husband is required to wear when we leave the hospital and required to wear 24 hours a day because his heart's taken significant damage. It could just stop, and they want to make sure he has a life-saving device at home because we are so far away from the hospital. So this is the vest, y'all. This is the Zoll Life Vest. The paddles, that defibrillator paddles, go in these two little pockets in the back. There's wires that come down and go here. Everything's color-coded, Velcro, no-brainer. Wires going here, and this is the front defibrillator paddle in here. And then there's a wire that comes out and goes down into the brain of the life vest that you carry in a little bag. And you have to change those batteries every 12 hours. So morning, we decided 8 a.m. and 8 p.m. I changed those batteries. So you get 2 batteries, battery charger, the brain, the defibrillator paddles, and all the wires, and 1 vest. You have to keep the vest clean, y'all. My recommendation is ask for a second vest. Fortunately for us, this is a little flexible. They gave us a vest that fit him. It was a tiny bit loose. He'd lost a lot of weight while he was in ICU, and like 30 pounds. So when we got home and he started eating again, he put on some weight. He needed a larger vest. So I called Zoll and I said, is there any way we can get a size larger because he's gained some weight? She said, oh yeah. We had a new vest the very next day. So that was great. But if I were you, and looking back, I would be asking for a second vest. I don't remember if insurance didn't pay for it or what, because you've got to wash this, y'all. And it's got to be hung to dry. So that's going to take some time, and you have to keep it clean. You also have to be very careful about lotions, oils, soaps, because this is all conductive mesh on these defibrillator paddles, y'all, and you can't corrode that. It has to stay good, or the paddles may not work if his heart stops. So it's a lot of care with this. You have to get into the routine of the batteries. You have to make sure you know how to work that brain, listen for the alarm when it comes on, when you change the batteries, know how to turn that alarm off. You get good training before you come home. But if you're sent home with one of these, wear it. And your caregiver has got to know about it, has got to know, have the Zoll number handy, have the cardiology emergency number handy, and know how to use, clean, and set up this vest. Very, very important. And it doesn't hurt to have somebody else know how to do it too. So he's wearing this vest 24 hours a day, and it starts to give him some anxiety. Plus, he just went through a massive life-changing event. So he's having a lot of anxiety a few weeks after he comes home. And he's pacing the floor at night. He cannot sleep. He cannot get comfortable. He's having some claustrophobia problems because of the vest. And everything he's been through has been a shock to his system. So he needs some help. So the doctor called in an antidepressant, which he didn't want to take. And I said, well, honey, the only other option, why don't you come to me with my therapy session and talk to my therapist and see if there's something she can do to help you. Because she said she would love to help you with this anxiety problem. And he said, well, I think I better try it. He's not a therapy fan, y'all, but he has seen what it has done for me in the last year. So he agrees to go. We get there and we walk in the room and I introduce them and I tell him I'm stepping out of the room. You need to be able to say whatever you need to say without worrying about my feelings, without worrying about how I'm going to take something, without worrying about protecting me in any way. You need to be free to say whatever it is you need to say. So this time is for you. And I stepped out. He wasn't happy about it, but it was a really good decision. She did help him. He went back with me a couple more times, and this time I stayed in. He wanted me to stay with him. I'm kind of his security blanket, y'all. So, and we talked about a lot of things we hadn't really talked about in our marriage. And hang on, I'm going to turn that off. So, if you can still hear me, he apologized for a lot of things he should have apologized years before. We talked about some unfinished business we've had during our marriage. And we also talked about where we wanted our future to go, you know? And we worked through a lot of things, and we worked through all of that anxiety. And he started sleeping again. He started feeling better, and he really started feeling good. But he's still wearing this vest 24 hours a day. He's going out. He's got physical therapy, home health's coming out, doing physical therapy 3 times a week. And then we do walking and stuff on the days they don't come. So we're going outside, and it's starting to get hot. And he has sensitive skin. He starts getting rashes on his back. And you have to be careful about what you use with this vest. So there's times when he just takes it off and tries to give his skin a break. And he got where he started taking it off at night because it was causing him anxiety, claustrophobia. And so he started taking it off at night. And then one day he was just like, I'm just not wearing it anymore. I don't know why I need it. I'm doing fine. I'm improving. Everything's going great. I'm just going to quit wearing it. So he quit wearing it. I got a phone call from Zoll about a month later saying, hey, we haven't been getting any transmissions from this. Is the equipment okay? I said, yeah. I told them what was going on. And she said, well, do you think he's going to start wearing it again? And I said, no. I said, it really caused him a lot of claustrophobia issues and the rashes we just couldn't get rid of. So she said, okay. She said, well, I'm going to cancel the renewal order. And she said, go ahead and box everything up and put the return sticker on it, sit it outside the door, call the number, and they'll come pick it up. And I said, okay. So I did that. So don't throw that box away, y'all. Y'all got to have it. Because if you don't return it in that box, they're going to charge you. And it's thousands of dollars of equipment, y'all. So keep the box and return it when they ask you to. So now they're scheduling him for a permanent defibrillator pacemaker because it's all in one. And he's not a fan. He doesn't really want it. But the brain surgeon wants it as a little insurance policy for this next deep brain stimulator because they've only done one side. They have to do the other side. So she has requested it. So he said, okay, well, I'll do it if I have to for that brain surgery because I want it because he's having difficulties, y'all. One side is stable and normal and not tremoring anymore. The other side, the tremor is actually getting worse. So he's getting unsteady. This brain is fighting this side of the brain and he's getting unsteady. He's had a fall or two. He's having more difficulty walking and he's talking. He's still tremoring in his voice. His chin is still tremoring a little bit and he's wanting that side fixed. It's really bad. I mean, we can't drive down the road that his hand is not tremoring. He cannot hold my hand that his hand is not tremoring. He's starting to tremor all the time in his hand, his legs, his voice. So it's causing him a lot of problems. And we met with the cardiologist and we talked about the deep brain surgery and when we were talking about the defibrillator. And he said, it's a high-risk surgery for you after everything you've been through. He said, I'm not sure about anesthesia. You're going to have to get that approved with anesthesia. He said, but if this is affecting your quality of life to the point that you feel it's worth the risk, then I'll approve it. And he said, it's absolutely affecting my quality of life. He said, I'm struggling. And so he approved it. So now, scheduled to get the defibrillator, which we get. We go back up and we have the defibrillator pacemaker put in, and they put it up pretty high. So he's not really happy about that. He can't shoot a rifle anymore. It's uncomfortable. If I lay my head on there, it hurts him. So he's not happy about that. And he'd really like it removed. And that surgeon did tell him, if you don't like it, we can take it out. So we'll see where that goes. He's still got it, but he would like it removed. So that's where we are, y'all. The other thing when we were dismissed from the hospital, this hospital was so good, you guys. He has a lot of new medications, a lot of new heart medications he wasn't on before. And we have Eliquis and Jardiance added to that list, and they are very expensive. They're like $500 a month a piece, y'all. So they called all the pharmacies. They had one nurse, and she called all the pharmacies in our area, an hour away. All the big pharmacies, all our little local pharmacies. The price of them was going to be $1,000 to $1,200 a month. And she said, we're not going to do that to you. You can't afford that. And I said, no, oh my God, no, we can't afford that. And she said, what we can do, we can go through our hospital pharmacy and we can get that at a better price. It'll be about $700, I think it was like $720 for a 90-day supply, and that included both medications. And she said, you can pick that up today when you leave, and then call, refill it, and we will mail it to your house, and we will just continue that until your pharmacies catch up with that pricing. And I was like, that is a godsend. I said, I can't even believe you did that. And she said, this is what we do for our patients. We want you to be on the medications. We know these are expensive. So if we can do something to help, that's what we're going to do. So if you are given a medication at one of these hospitals when you're dismissed and you cannot afford it, talk to them. Ask them if they can help do something like that. Ask them if you can get it through the hospital at their pricing, because that was a huge cost savings, y'all. $700 every 3 months instead of $1,000, $1,200 every month. Huge amount of money. Medication should not be that much, especially heart medications, life-saving heart medications. That's a soapbox I could get on. So that's where we are now. He's taking all these meds. So I now have to manage a ton of medicines. I have to manage our finances. Thank God for something called My Chart. Everything is on there. Appointments, they change the appointments. Things come up. They have to change the appointments, move the appointments. They want you to see this doctor or this PA. It's a lot to manage. And I'm older. I have brain farts. So I can go into My Chart at any time and see what we've got coming up. Make sure that's on my calendar. Make sure I'm aware of it and where it's at. Because every once in a while, these doctors come an hour away. So we just have to go an hour to see them. But most of the time, we have to do the 3.5-hour drive and then the 3.5 hours home. It's a full day to go see these doctors. So new Life Vest, we got to manage batteries, got to have that schedule, 8 a.m., 8 p.m., whatever you decide, but you've got to stick to it and you've got to get in that routine. And if your loved one is having anxiety and problems, get them some help. Don't wait. Don't think you can handle it. Don't think it's just going to go away, because it's not. This is serious stuff. And this is a normal reaction to a massive life-threatening event. Plus you have to keep in mind, he's got like 6-7 days he has no memory of. Time just, one day he was working in the yard and the next day he's waking up with all this crap in him and he doesn't remember anything in between. That's a huge shock to your system. So he has a lot of shock he's processing. He's still got that missing time. He still doesn't remember it. So, and that's a blessing, honestly, because it was horrible to go through. He doesn't remember any of that first brain surgery. He doesn't remember waking up. He doesn't remember eating the Jell-O. He doesn't remember any of it. None of it. And I just have to say that's a blessing. So he's been through a lot, and I've had to help him get through that. And I have to manage everything. Home health brings you a whole packet, and they give you a lot of information. You are just bombarded with information from everyone. But so many people are there to help you. So take it. Take the help and do all the things you can do. And if you cannot manage all of it and you're struggling, ask for some help or ask for some tips to help you figure it out. Ask a family member, ask a friend, ask a neighbor, talk to the home health nurse and say, look, I'm overwhelmed. I don't know what to do. This is where I'm at. They will help you. So good luck to everybody. It's a lot to deal with. They're dealing with a lot, and my focus is on everything else. I want him to focus on getting stronger and feeling better mentally and emotionally and physically. I want him to be in a very good place. I'll deal with everything else. I'll put everything else on my shoulders. He's got to deal with him. And that's how it's got to be. And thank God I've got a lot of family and friends here that are willing to do for me and look out for me. So family time is important. Work it in. Good luck, everybody. It's a lot, but ask questions and ask for help. That is my biggest thing here, I guess, right now, because you've got a lot on your plate, a whole lot on your plate. And it gets overwhelming, and you can have very, very hard days yourself. You're going to. So go take a walk. Go take a walk. Go to Walmart and just walk around. Go to the park. Just take a break. They'll be okay. You can walk away from them for an hour. It's okay. You got to do that.